Good afternoon, sir. First of all, I thank all the organizers to give me this opportunity to present in front of you all. Today, I'm going to present a very small topic, the significance of FRC in COVID-19 patients. I'm Dr. Asiq Sideeque from MES Medical College, and also I'm working in Korambil Hospital and Diagnostic Center in Malappuram. That is in Kerala, the central part of the Kerala. The causes of coagulopathy associated with COVID-19 is poorly understood. A variety of markers are available in the laboratories to assess the endothelial activation, intravascular hemolysis, coagulation, and end organ damages. A battery of investigations are there. So here I am concentrating only one parameter or investigation, that is fragmented red cell. And it is the International Council for Standardization of Hematology evaluated and suggested automated fragmented RBCs is a useful routine screening tool in the hematology lab for schistocytes. It offers advantages such as improved precision, immediate availability, and good agreement with microscopic schistocytes. The method I'm going to discuss here. The study population we included are 104 COVID-19 TrueNAT duplex positive cases whom were hospitalized and had routine investigation for COVID-19 complications. In the present study, we included only D-dimer for thrombotic microangiopathy, CBC and rhetoric for fragmented RBCs, peripheral smear for schistocytes. Other parameters for COVID-19 complications were not included. I used this instrument, Mindray BC 6800 plus. And even though it is not included in the reportable parameters, it is still in the research tool, and I taken a cutoff of 2.5%. Another instrument I used is ACL Allied Pro. The high range of D-dimer is between 0.6 to even more than 20 mg we considered in the study. Peripheral smear, of course, we counted for the schistocytes. Normal range is less than 1. More than 1% we considered in the group. Statistical analysis were done, included only COVID positive and high D-dimer with fragmented RBCs and schistocytes in peripheral smear. Though we were reviewed all demographic attributes like age, sex, baseline, comorbidities like hypertension, diabetes, kidney disorders, liver, pulmonary, cancer disorders are not included in the present study, though we reviewed. Similar way, all the laboratory tests like blood chemical analysis, coagulation studies, CBC with retic, there are a lot of parameters, significant parameters is there in COVID patients, and peripheral study were reviewed, but which is not included in the study. The result as a routine CBC with retic were performed on admission. Those patients were TrueNAT duplex COVID-19 positive. Then fragmented RBCs were compared with D-dimer. The COVID-19 positive high D-dimer cases compared with FRC and the schistocyte from peripheral smear. We notice that cases in which high FRC showing high D-dimer is 96 out of 104 cases. High schistocytes in high D-dimer cases also 62 out of 104 cases. Total D-dimer positive cases were 104. Both positive, that is fragmented and schistocytes, is 62. Both negative is 0.8. Fragmented RBC alone is 34. Schistocytes alone is 3%. 3%. Or 3 in number. Then we are done the FRC parameters, the sensitivity and specificity. Those were 64.5% of sensitivity and 72.75 of specificity, and which have a positive predictive value is 95.3%, and negative predictive value is 19.06. We also calculated p-value. Chi-square statistics is for the FRC is 5.7617. The p-value is 0.016379, which is well less than 0.05, which is significant. Similar way, in schistocytes, chi-square statistics 4.3032, p-value 0.038041, which is also less than 0.05, and it is significant. On discussion, thrombotic microangiopathy is well established in COVID-19 patients. And it has got a triad: microangiopathic anemia, thrombocytopenia, and organ failure or damage. Our cohort, we found in COVID-19 patients, there is evidence of microangiopathic anemia, that is D-dimer, and schistocytes is well correlated with fragmented RBCs, FRC, if we run electronic counter with reticulocyte count mode. The FRC have better sensitivity, specificity, and lower p-value than schistocytes manual count. Hence, FRC can be used as a screening tool in COVID-19 patients before doing D-dimer and schistocytes on peripheral smear. It's all these two parameters. Either it is expensive or counting astrocytes on peripheral smear is little tedious also. FRC give, if you run it in erratic mode, and very easily you will get the result out on a cheaper price. So I have a suggestion that in all the COVID patient, better to do CBC with retic rather than doing only CBC. And in my clinical colleague, well appreciated with FRC, and they are doing a comparison with FRC and early heparinization of these COVID patients. The study is on and it's going on. Thank you.